Good morning, everybody. Thank you for joining us today. This is Amy Hewitt. I am the Executive Director of the Scleroderma Research Foundation. I want to share with you we've reached an exciting milestone today. This is our 20th live webinar. Through our series, we've covered a wide variety of topics from emerging therapies to lifestyle management. And as research, diagnostic, and treatment options continue to evolve, it is our commitment to bring these latest developments to you through this series. The SRF webinar series is made possible by a generous grant from Gilead Sciences. We'd like to thank them for their continued support. It is now my pleasure to introduce our special guest today. Dr. Janet Poole is a professor in the Occupational Therapy Graduate Program at the University of New Mexico. She has worked with scleroderma patients for over 20 years and specializes in the effects of the disease on daily living. Dr. Poole has developed a hand exercise program and self-management tools for people with scleroderma. Today's session will feature 40 minutes on exercises to improve movement and function in the hands, face, and mouth, as well as the use of devices and alternate techniques to increase independence and protect the hands. We'll then wrap up with about 15 minutes of Q&A time. The phone lines have all been muted, so if you have a question, please use the chat box in the conference window. Remember that our webinars are for educational purposes only, and no information provided is to be considered personalized medical advice. It is now my pleasure to turn the presentation over to Janet and improving function of hands and face, tips and exercises for scleroderma patients. Thank you so much for being here, Janet.
Thank you, Amy, and hello, everyone. It's a pleasure to be here today to talk to you about the exercises and tips for improving function in the hand and the face. My email address is on the first slide, so feel free to email me if you have any questions that don't get answered today or you think of some at a later point in time. So the objectives of my talk today are for you to understand the importance of early education to maintain optimal hand function and mouth opening, to be able to identify exercises and modalities to improve motion in the hand and the face and mouth opening, and then I'll briefly talk a little bit about some evidence to support exercises. Mainly, I will give you some resources for that. So I will start today by talking about some of the typical contractures that are seen in the hand, the decreased bending or flexion of the metacarpal joints. Trying to find my little arrow here. Right here are your big knuckle joints in your hands, and sometimes people have a difficult time being able to bend those. Sometimes people have a harder time straightening the PIP joints, which are these joints right here. They're the middle joints in your fingers. And also times people have problems with their thumb, of being able to move their thumb away from the hand, what we call abduction. That's the motion that you need to hold a large cup or a bottle of water. So this slide shows some of the other hand symptoms. I put this in here because they affect your ability to use your hands and can also make it painful to do some of the hand exercises. So you can see the calcium deposits. Sometimes people have puffy fingers early in the disease that make it hard to move their fingers. The Raynaud's with the color changes that most of you are probably aware of or probably have, and then the digital ulcers and scars that oftentimes you have to work around when you're trying to do the different hand exercises. So I'm going to first talk about some of the modalities that can be used to help manage pain and increase joint motion. So some of those are heat modalities like moist heat you get from paraffin bath or hot packs, a dry heat, which is fluidotherapy. It's a piece of equipment, but that you need to have done in an OT or a PT clinic. Massage can also be very helpful, a connective tissue massage or a manual lymph drainage massage, and I'll talk a little bit more about each of those. And it's best to try and use the heat and massage before you do the stretching exercises because they can help warm up the tissue, but you don't have to. So paraffin wax is a really great modality for people with scleroderma because there's oil in the wax, and that can serve as a moisturizer to help keep your skin from drying. And then the heat is delivered through superficial conduction, and that helps soften the skin. So the temperature of your paraffin unit, you can buy paraffin units in most stores like, your Targets, Walmarts, any of those types of places. The temperature should be about 120 to 130 degrees. I would use a thermometer, like a meat thermometer, to try and check the temperature and not just rely on the settings with that. Do not use the paraffin if you have open sores. And what you do if you haven't done this before is you just dip your hands in the paraffin, and you dip it about 4 or 5 times. You place your dipped hands in plastic bags, and then you wrap heavy towels or place them in oven mitts and keep it on for about 15 or 20 minutes. You may only be able to do one hand at a time unless you have somebody who can help you with that. And then you just take the wrap off, and then you can peel it off, peel the paraffin off just like a glove, and you can put it back in your paraffin unit, and you can reuse it several times until you notice that it kind of gets, yucky and discolored, and then you have to replace it. So hot packs or heat is another way to deliver superficial heat, and you can buy hot packs, in a store. But whatever you do, make sure that you wrap them. You usually have to warm them somehow, like in a microwave. Make sure that then you wrap them in a towel, a thick towel, before you place them on your skin, because you don't want to have a skin burn. You can also make your own. This one up here is a sock that is filled with about a cup of rice, and then there's a knot tied in it, dry rice that is. And then you can put it in the microwave. It's sort of the cheap version of a hot pack, and warm it for about 30 seconds and see if that's warm enough. But regardless of what you use for a heat pack, just keep it on your skin only about 10 to 15 minutes. But if it's too hot, take it off immediately and make sure that you let it cool. The bottom here, this shows that this is a fluidotherapy unit. It's actually these dried corn husks that move around. And it can help loosen up the skin and the tissue, but it does have a drying effect. Massage, there are different types of massage that can be done. Connective tissue massage, like in this slide, is a deep stretching massage, and that can loosen up the tissue. And then this one over here is a manual lymph drainage. It's a mobilizing massage that's designed to move fluid. And oftentimes this has been helpful in the early stages when people have the puffy fingers. But both the massages need to be done by a trained therapist. And at the bottom are some references. So now we're going to start with the actual exercises. So these are range of motion or stretching exercises. And they can be done, hopefully the purpose is to prevent or slow down the development of contractures or limitations in joint motion. These should be done frequently and beyond the point of resistance. So even when you're doing them, it should be a stretch. So try and maintain the position of the stretch for 3 to 5 seconds, even if your skin kind of blanches or turns a little bit white. But then what you have to do is then relax and let the color come back in. You should try and start doing these motions before there is any noticeable loss of motion. So if you all take a look at your hands and see how straight your fingers go. And I'm going to ask you to do these exercises with me, although you can't see me and I can't see you, but I think we'll be able to do it just fine. So look at your fingers as you try and make them go straight. And now make a fist. And hopefully all your joints bend about 90 degrees, and your fingertips should touch the palm of your hand. Some of you, that may happen already, and they may not be able to be straight. But even if this looks pretty good and you feel a little tight, then these exercises are still for you. So the first one is for the flexion or bending of the, we call it the MCP joint, the metacarpophalangeal joint, but it's really the big knuckle joint in your hand. So the one here on the left shows, so make a fist, and then use the back of your hand, or the heel of your other hand, to push down right here on the back of your fingers closest to this joint. So push down and hold it. I usually say count to about 5, and then straighten your hand back up, and then do it again. hold it, and then straighten your fingers again, and then you can do the other hand. So this one over here is for the smaller joints of your fingers. And so this one, so try and bend your fingers one finger at a time. Try and touch the tip of the finger to the palm of the hand, and then use your thumb and your index finger to try and push that and bend these joints a little bit more. So everybody try that. So bend one finger, use the other hand to try and bend the other joints in your hand, and then straighten out your finger. And you can see here that the skin is starting to turn a little bit white. So what I would suggest, if that happens to you, and even if it doesn't, is to straighten that finger back out, let the blood rush to it, then go on to the next finger, do the same thing, and then the ring finger, and then the little finger, and then go back and do them again. You should repeat each finger until you've stretched it about 3 to 5 times, and then do the other hand. You can do these exercises, just sitting around, waiting for an appointment, watching TV or something like that. You don't have to do them at a specific time. So these exercises are for the middle joints of the finger. And in people with scleroderma, a lot of times those joints are the first ones that become bent. They don't totally straighten all the way. So if you can't straighten this joint completely, then these are exercises that you probably need to think about. So the top one here is to put your hand like flat on a table. If you're sitting at a table, you can put it on your lap, but that doesn't quite work as well. You need a hard surface. And then use your other hand to push down on your hand, especially trying to get those PIP joints, and try and push down so that the palmar surface of your fingers is in contact with the table. And just hold that. And then relax, and then you can do it again. And also repeat with the other hand. The one over here on the right is putting your hands together, like in a prayer position. So you can all do that. Put your hands together. And your goal here is to try and have the palmar surface of your fingers and your hands touch together. And that may not happen. That's okay. But try and push your hands together as much as you can. So that helps to try and straighten those joints. Now the two at the bottom here use 3 points of pressure. And this is a little trickier to explain without being able to see, so hopefully the pictures will help you a lot. This one, because you do each finger at a time, it should be used if your fingers are pretty contracted, I mean they're pretty bent, or maybe some of you may be lucky and only have one finger or 2 fingers that are bent. So this one here, so what you need to do, if you can, put your hand down on the table or your lap, put your finger down, put your thumb of the other hand on top, on the back of that PIP, that middle joint there, and then try and lift up the tip of your finger under the fingernail. So you can all try that. Push your thumb down on top of the joint on the back and try and lift up the finger. You may not be able to lift it very much. That's okay. And if you have your lap to do this with, just try and straighten it. And then you would do that with each finger and repeat it, and then with the other hand too. This one over here is a similar one, although you're not using the table to do it. So for that one, let's follow along with what the picture shows. So we're going to, everybody kind of turn your left hand palm down or a palm away from you. Put your index finger on the palm side of your hand, right there, like that person is doing, underneath that part of your finger. Then put your middle finger on the same side but below the joint. So you have your index finger on top above the joint, but it's on the palm side of your hand. Your middle finger below the joint on the palm side of your hand, and then you're going to take your thumb and you're going to push on the top of that PIP joint. Now this is the one I talked about earlier, that if you have a sore on the back of that finger, that will not feel comfortable at all. But what you still can try and do is try and maybe push around the ulcer. So like this person is pushing sort of below it, that joint a little bit. And you're really using 3 points of pressure. 2 on the bottom are pushing up. The one on the back of the joint is pushing down to try and straighten out that joint. If you have really bent fingers, it may be difficult for you to do by yourself, and you may need somebody to help you a little bit, like a family member. But they're really great exercises because they focus on each individual finger. Okay, if you have severe contractures of your fingers, so especially like this person does, obviously that other exercise would be impossible to be able to do. So for this one, what you could try and do is hook your fingers over a chair or a table edge, like this person is doing, as much as you can, and then just pull your hand back towards you, but keep your fingers hooked over the edge of the table or the chair. If your fingers are contracted as much as this lady's are, you may not be able to get them very much straighter, but hopefully it can keep them from bending more. I see a question over on the side, and I'm going to answer it right now because the question is about Dupuytren's, that some people have that stretching might make it worse or progress quicker. Dupuytren's is a totally different condition than scleroderma, so I think you could still do these exercises but what you could do is keep the big knuckle joint bent while you're trying to stretch the middle joint. And hopefully that answered that person's question. Okay, we're going to move on to the thumb now because a lot of people do have difficulty bending their thumb or opening their thumb wide enough to hold on to like a large glass. So the ones on the left here are for thumb, what I call abduction. So abduction means moving your thumb away from your hand. So this one here at the top, if you put your tops of your index fingers together and your thumbs together, and then what you try and do is you try and pull those fingers sort of away from each other. And the arrows kind of show the direction that you're trying to pull. And that's trying to widen the space right here called the web space that can become tight in people with scleroderma with that. Then the one here on the bottom left, just hook the sort of the tip of your thumb over the table or a chair arm, and you just kind of let your hand drop down and pull away from the table. So that may be easier to do too. The one on the right here is for thumb flexion. And sometimes people have a difficult time bending their thumb. So for this one, what you do is bend your thumb. Your goal is to try and touch this part of your thumb to the bottom of your little finger. Like that. And you can see that that's really hard for the person in the picture. So try and do that as much as you can, and then you can use your other hand to try and push it a little gently to touch the bottom of the little finger. Okay, these exercises are for the web spaces, which is the area between your fingers. And sometimes in people with scleroderma, that becomes really tight, and it can be difficult to put on gloves, or maybe for keyboarding, or if you play a musical instrument, having that stretch ends up being really important. So the one on the left here is to interlace your fingers together and then try and slide your fingers all the way down so that the web spaces, and these are the web spaces between the fingers, are touching. And you can see in this person, they have tight fingers there, that it's difficult to do. That's your goal. Even if it's difficult, just try and do it as much as you can. to try and maintain that space. The one on the right here is used. This was a gentleman who had scleroderma told me about this one. He said he used it all the time because most people carry around like a bottle of water, so you just can kind of nonchalantly slide it between your fingers here and try and push it down as far as it will go. Granted, it may not go very far, but that's okay because it's still stretching that web space. So you put like the top of a bottle of water just between those fingers, and then you would do it with each group of, like here, between the the middle finger and the ring finger, and between the ring finger and the little finger, and that will help stretch it out. So exercises for the wrist. There's a couple ways to do these. Wrist extension is when you bring your wrist back, like when you hold on to something or grip something. So one way to do it, as in this top picture here, or again to put the palms of your hands together as much as you can, and then point your fingertips away from you, and then try and bring your hand towards you so that the sort of the heel of your palms touches like your stomach area. And that, if you look down at your wrist, they should be bent around 90 degrees. That's okay. If they don't bend that much, then probably you need to keep doing that. If you can't bring your hands all the way in toward your stomach, that's all right too. Just do it as much as you can. Then the exercises down at the bottom, this one here is also for wrist extension. So turn your hand palm up, one hand palm up, and then use the other hand to gently push on the palm of that hand to try and push your not your fingers so much, but your hand down towards the floor or the table. So do that very gently, and then you would repeat, of course, with the other side. The one on the right here is for wrist flexion or bending the wrist. So bend your wrist so your fingers point down to the floor as much as they can, and then use the other hand to push very, very gently on the back of the hand. You need to be careful. Don't push hard, just gently. Even if it doesn't bend very much, push gently, because you have the carpal tunnel. Have heard of carpal tunnel? Everything is kind of in here, so you don't want to squish it. Okay, this slide shows a way to keep track of how much your fingers actually straighten in the joint. So you can take a piece of paper and draw an outline of your hand with your hand as flat as it will go. So for some of you, your fingers may be bent quite a bit. For others, you may go very flat. So you have to press on the finger joints to get it as flat as you can. So you're probably going to need somebody to either push on the finger or to make the hand drawing. If you have kids or grandkids, you guys may remember that you might have done this yourself. You can make a turkey out of it. But keep the shape. Don't lose that even if you have turkey parts on it. And then your goal is to to check every now and then by putting your hand in that hand outline. And now if you look at this picture here, she needs to probably work on those finger extension, the PIP extension of the middle joint exercises a little bit more. But when you put your hand back in that picture, I didn't have her do this for the purpose of taking the picture, is to push on the hand again flat to make sure that the fingers tips actually go back into their spots. But that will help you kind of check it out, because sometimes some of this loss of motion can sneak up on you. This slide shows a way to keep track of how much your metacarpal phalangeal joints, MCP, or the big knuckle joints, bend. So you can make a kind of a template, and again, have somebody either help you draw this for you. You could take like toothpicks and have somebody tape them together at the angle that you want, and then put it on a card. I mean, these are. If your hands have difficulty cutting and doing all that, then get somebody to help you. If you're seeing a therapist, you can have them help you make something like this. And then you just have to make sure you label them with the finger that it is. And you just put it over and make sure that you keep bending at least that much. The other joint, I didn't make one for the middle joint of your hand because that seems to like to bend a lot more than it likes to straighten. And though you can monitor this every couple of weeks or once a month just to make sure that you really aren't having too much of a loss of motion. This is a way you can monitor or keep track of how wide your web space is, which is that space between your thumb and your index finger. So what you can do is try and find the largest size object that will fit in that web space with all the sides of the web space touching. And by that I mean here's the web space and all that is touching on both of these. So one's a spice bottle and one is just a bottle of water. For this one here, it's a can, but you can try tomato paste or a spice can. The object is too large. So find something that fits, and then you just kind of slide that in there. You could also use this as an actual stretching exercise too. Just kind of stick it in your hand there and leave it for a little bit. And then we also have other upper extremity joints that your hand has to go somewhere. The rest of the joints are what puts it in the position to be able to use. So these show some exercises for the shoulder joints. The one on the top left there is for shoulder flexion, which is like bringing your arm up over your head. So what she did is she walked her fingers up a wall, and then she can lean into the wall. If you have your inside your door sills that you could actually, don't mind putting a little pencil mark or something in there, then you could kind of mark that at where the tip of the finger that goes the highest is, and then use that to keep track of it. The other two and the middle one here and on the right are for shoulder extension or external rotation, but what they really are trying to do is to stretch out your pectoralis muscles, across your chest. We all do a lot of computing now. We're over our phones. They're all hunched over, and these will stretch out that chest area that's also really important for breathing. So in the middle one, put your hands behind you and around your back and see if you can hold them together. If you can't, that's okay. Just put them back there, and then try and lift your arms away from your back and hold that. Try and bring your shoulder blades together. So you're really stretching out that chest area. And then the one on the far right there for external rotation is put your hands behind your neck. Try and bring your elbows up to shoulder height as much as you can, and then try and bring your elbows back behind you, and again, bring your shoulder blades together. Try not to bend your neck while you're doing this. Try and keep your head, your neck, and more look straight ahead. And then hopefully you can feel that stretch across your chest there. And the one at the bottom, if you look at your hands, turn them palm down, and now turn them palm up. Some people have difficulty turning their hands palms up. Your palms should pretty much face straight up to the ceiling. So, excuse me, it's using a rolling pin here, but you could use something similar to that, maybe a ruler. And then what he's going to do is he's going to turn, so we're going to stretch out the left side here in the picture. So he's going to turn the rolling pin, cross his arms here, and then that will stretch out the palms up on the left side here. And then you could go back the other way for palms up on the right hand with that. But that's a nice stretching exercise to do too. And again, with all the stretching exercises, try and hold it like 3 to 5 seconds. And you can count that by 1 1,000, 2 1,000, 3 1,000, etc. to really try and hold it for that amount of time. And then reverse, do the other hand or the other finger or take a break. And then try and do them all about 3 to 5 times each, depending on how tight you are and whatever joint it is. These are just some different dexterity exercises that you can do. You can probably think of your own. If you have kids or do anything with your hands, knitting, crocheting, playing musical instruments are all good too. Those Chinese qigong balls, some come in small sizes. You can try and move them around. If you don't have those, what you could also do is make balls out of your paraffin wax And after you take them off, it's still warm, and move those around in your hand before you put them back. You can try and touch touch your one thumb to each finger quickly, going one direction and coming back the other. You can lift and lower your fingers quickly one at a time, like in this picture. And then you can just try and manipulate coins or other objects. So you not just pick them up, but kind of position them in your hand and do something with them. Okay, I put this slide in here because oftentimes people who do have hand contractures or hand difficulty have difficulty with manipulation. So there is a lot of different types of equipment that's out there, assistive devices. This is a key holder. There's a bunch of different kinds. The OXO tools have larger handles. These rubber lids have sticky material that can help you open jars, medicine bottles. The wine-shaped glasses, because of the smaller bottom here, can be helpful. There are button hooks, or you could just not wear shirts with buttons if that might not be a possibility, though, for some people. And then, having the electric jar openers, can openers. I put the slide on the other side, on the right side, about protection for Raynaud's, because that is also key to your hand function. Trying not to have as many Raynaud's can, of course, affect getting ulcers. So using gloves and mittens. This here I put in this is a car warmer, only because that warms your core, and as you know, warming your core can also protect you from Raynaud's. This is a Silipo. It's S-I-P-I, oh, I can't spell it, sorry. S-I-L-I-P-O-S. S-I-L-I-P-O-S sleeve that has a little gel piece in here that you can slide over your fingers to help protect them. If you have a joint, a PIP or middle joint that's bent a little bit and you keep bumping it on things. And then a lot of people, of course, use the hand warmers and put them in mittens or gloves to help keep, or even your pockets to help keep your hands warm. Okay, so we're going to move on to face and oral exercises next. So the face and skin manifestations in the face are not as well known or studied as in the hands, but people with scleroderma, of course, are very well of the skin and the changes that happen around the mouth. So people can have reduced mouth opening, like in the slide picture here. People's skin can get tight. They can have dry mouth or xerostomia that can affect oral hygiene. And then also people have a difficult time opening their mouth. It makes it hard to brush your teeth. Some people have increased dental caries and periodontal disease because of the dry mouth. And then sometimes people have a difficult time eating, depending on how affected their mouth is. So it's opening, the opening of your mouth especially is very important due to, of course, dental, being able to go to the dental and have dentists and have the hygienist work on it. Eating maybe foods that you love, brushing your teeth. And then some people, it does also affect their talking, although that can also be due to other things like some pulmonary problems. So you can use heat on your face to relax it a little bit before doing some of the exercises I'm going to show you. Massage can be done to the facial areas, but again, oftentimes this needs to be done by a person who's experienced with massage. But you yourself can use warm towels on your face or even warm water from the shower. And some of the exercise I'm going to show you, you might rather do in the shower where nobody can see you do these. So if you're by yourself now, you can do some of these exercises. You can do them if you're around other people too, but they might question what you're doing. So the first one is to open your mouth wide, like the lady is doing in the top left picture. Open your mouth as wide as you can, and again hold it for about 3 to 5 seconds. You can also do, so everybody do that, and then close your mouth, and then try it again. You can also purse your lips. You're going to smooch somebody or blow out a candle. You can also blow up your cheeks, like in this picture, so keep your mouth closed and then puff up your cheeks as much as you can, and that helps stretch out those muscles. And then just do a big cheesy smile, like the biggest smile that you can do. Like I said, sometimes you can do these in the shower in the morning or in the evening, and because the warm water can help loosen up the tissue. So those are just sort of general face and mouth exercises. And these two exercises are specifically for stretching. So the one here is manual stretching of the mouth, and a lot of these you can do too while you're waiting for the dentist or hygienist to come in, before you brush your teeth. So what you do is you put one thumb on the corner of one side of your mouth. So if you have your right, let's say take your right thumb and put it in the left corner of your mouth, and then put your left thumb and put it in the right corner of your mouth, and then pull to stretch your mouth like she's doing in the picture here. So you pull, each hand pulls away from the face and to try and stretch the mouth here. The bottom exercise is an augmentation with tongue depressors. So what the person does here is got several tongue depressors, and can put them together with a rubber band or a hair band, and then as many as you can get in your mouth from like the premolar area to a back molar area. And you put them in there and you just hold it again. Now if you have TMJ pain, or you've been told that you have or have a lot of pain with this, then don't have as many tongue depressors. You only put as many as can comfortably fit, and then you try and add them as your mouth stretches. And then you take it and you reverse it and you put it in the other direction. So that's oral augmentation. But you may want to talk to your dentist about that, especially if you may have some dental problems or TMJ pain. So the next slide here shows that you can also monitor your mouth opening. And we talked about why that was important, because that can also sneak up on you. You don't really notice it until you go to the dentist again. So if you open your mouth as wide as possible, and then measure from the bottom front teeth to the top front teeth. And then you make a card or find some sterile object that's the same width to use. Or the other thing you can do is you can open your mouth as wide as possible, like here, and have somebody help you mark like the bottom of the front top teeth and the top of the bottom teeth, and then you can hold that up to a mirror and just check and make sure that you still can open it that wide. There are some mouth opening exercises and splints. The OraStretch Prep, these are devices, they cost money, but there's little or no evidence in people with scleroderma. So do check with your dental professionals before you try or use any of these types of devices. But I just wanted you to make sure that you were aware of them. And then for your oral hygiene, you may already have these, but think about electric toothbrushes, water jets, curved bristle brushes, children's toothbrushes sometimes are easier to get in your mouth. Ask your dentist to use child-sized dental appliances, or your hygienist, because sometimes those will fit better. Larger handles, you can put foam on handles of toothbrushes. Shows electric tooth. This is a flosser that's a nice flosser because it's got a smaller head on it, but it's got a handle. So some people like those little ones that look, like the toothpicks with the curve on the end. That's fine too. If your hands have difficulty manipulating them, this flosser may work better for you, and then also like a water pick. And then in conclusion here, we have time for questions. I just want to say that heat and massage can be done before exercises to warm up the tissues. The range of motion and stretching exercises should be aggressive and started before you feel like you really notice that you have a loss of motion, or if your fingers don't go straight or don't bend. Monitor your hand motion using the little techniques and templates that I showed in the slides. Exercise and stretch all your hand joints to make sure that they stay loose, but try and concentrate on the joints that are the tightest. And the range of motion exercises should be done even with ulcers, although modify the exercises. So you may have to work around the ulcers over the back of your PIP joint, to make sure that you're working on the big knuckle joint and maybe the distal joint. Do the best that you can with that. Take care of your hands. Keep warm and protect your skin. And don't forget the face and the mouth exercises. Keep track of your mouth opening. Use a card, have somebody help you make a card, or make a card yourself and use that. And there is research evidence that the interventions that I talked about, particularly the stretching, the paraffin, the massage, and the joint manipulation, result in improvements in joint motion, hand function, and opening, mouth opening, or oral aperture with that. This slide shows some articles that were kind of review articles of different interventions. So if you need these or need to show or tell your doctor or anybody or therapist that you do need occupational or physical therapy, then these might be references to pull out. So I am done with the formal part.
Thank you so much, Janet.
Certainly. And
what's that?
I say we can open it up for. I just put this in the last slide about a study, but I'm open for questions right now. I think there's been some on the chat.
Yes, we have several questions, about 13 of them, if you can see in the question section, or I can feed them to you if you'd like.
Okay, let me go back to the beginning and see if I can find. Okay. So let's see here. Okay, so the first question was, if I have an open sore, can I put the plastic on before dipping in paraffin? So I'm not sure if the person is putting plastic on, like a plastic glue. Oh, I see what they're saying. Some people, but I would only do this if you're seeing a therapist, and I would ask your doctor, have put on a glove before dipping their hands in paraffin if they have an open wound. Now, you can't dip it in very far because you don't want the paraffin to go, into the inside the glove and your hand at all. But one of the problems with some of the stuff that gloves is made out of, it could conduct the heat more, so it could be hotter than you think it is. So I would prefer that, I would say don't do it. But if you are under the supervision of or seeing a therapist, you might ask them about that. With that. Okay, the other question is, if you're already contracted, pushing flat or against each other is counterproductive. It causes trauma to the fingertips. So again, if you have contracted, if you use the 3 points of pressure ones that I showed you, where you're pushing on the volar side, the palm side, above and below the PIP joint, and pushing on back of it, then you're not pushing on the tips of your finger with that. So that is one. Hopefully that answers that person's question with that. So you use the 3 points of pressure. Don't push the fingertips against each other, but use the 3 points of pressure where you're just putting the pressure right below, right above that middle joint there. Let's see.
I'm curious, Janet, what you had mentioned using a trained therapist. What type of therapist specifically? Is it massage? Is it physical therapist? And then
an occupational therapist or a physical therapist.
Okay.
And preferably somebody who has some experience with scleroderma. But as you all know, it's a rare disease, and it may. But if you have a hand therapist, they're pretty familiar with most hand conditions.
Okay. And what frequency do you recommend, or is it?
I think it would depend on people's insurance.
Okay.
Yeah. Let's see. One person asked here, are the mouth stretching exercises usually painful? They should not be painful. If they're painful, then don't stretch as far with that. If it's pain from your TMJ joint, which is where your kind of mandible, your jawbone connects to your, guess your head there, then that's a different problem, and you probably need to talk to your dentist about that. So they shouldn't be painful. You should feel a stretch, but they shouldn't be painful. And let's see. Okay, talked about the glove. Toe exercises. I don't have any resources for that, but that's a great question. But again, I think if you can try and bend your toes, like curl them up and try and then straighten them as much as you can, those are the similar types of, those are the big movements that we need with our toes, are the bending them as much as you can and then straightening them and trying to flare them out, like little babies do when all their toes go apart. Try and you can't do that anymore when you're an adult, but try to do that type of thing. That may help a little bit, and try and keep your ankles loose. Let's see. The JAS splint work to increase straightening or bending. I'm not exactly sure which splint that person is referring to exactly, but I will just put out a precaution there on using splints with people with scleroderma. Sometimes therapists use splints. They're a device that's added to the hand or the fingertip, and it can work on stretching through either rubber bands or springs or some type of material, but it puts a kind of a stretch on there. It's sort of a long, prolonged stretch. One of the problems, though, with people with scleroderma is sometimes there's often a cuff around a part of a finger, and then there's a pull, if that makes sense without me being able to show you. And sometimes that pull can exacerbate a Raynaud's because it can sort of cut off the circulation around the part that's in like a little finger cuff. Any ideas for key holders with porous supination? No, not really. That's hard because that's exactly what you have to do when you use a key. There are some that you can stick between your fingers, but again, you need the same type of motion. And if you're talking about a car, then you've got a limited space to do anything with, so I would say to try and use a key holder, but see if you have enough room to use your arm and your shoulder to turn it. But I know if you're in a tight situation, that could be hard. Of course, there are cars that have those buttons now. Not that you can go out and buy a new car, but there are cars that have those buttons now that actually you can start cars, so you don't need the key on that. But for doors and stuff like that, if you can just have enough room that you can move your own arm or your body to try and compensate for that lack of motion with that. And let's see here. I'm trying to, is there any?
Rosalinda had a question about exercises for the mouth for if you can't close your mouth.
Close your mouth, yes. I just saw that one. So if you can't close your mouth, again, it's to try and close your mouth, and then see if you can use your thumb and your index finger to try and push, on your lips to do that. So try and push your lips together, or try and use your cheeks, push on your cheeks to try and move your lips together that way, and see if that may help with that. If your lips actually go together, but if you feel like you're not strong enough to hold them together, you can try and do things like get a straw and blow bubbles in a cup, or blow bubbles, the puckering type of exercises, blowing bubbles, or have a straw in your mouth and try and blow like a little piece of paper around on a table or something like that. That's if it's weak. If it doesn't physically close, is again to try and push on cheeks and push on your top lip and on your bottom lip to try and bring your lips together with that. Neck stretches. Yeah, neck stretches, again, if you trying to, again, look up to the ceiling, and stretch the front part of your neck, trying to tuck your chin, not bend your neck, but tuck your chin in and then bend your neck. You should feel a pull on the back muscles of your neck, behind your neck, and then trying to turn your head, both directions to try and stretch out your neck. Let's see. with the next question is, with ulcers and calcium deposits, can't always tell when open wounds. Still okay to use the paraffin? I think I would be careful about doing that. If you have an area that you just need warmth or stretching, people have used paintbrushes to paint paraffin around the sores and hold it on. You can't. It's not quite the same job, but you could try and do something like that. Or try and, like I said, if you can see an OT or a PT that may be able to try you with different types of gloves and then dipping into the paraffin. Standard length of time for OT, again, that is dependent probably on your insurance, but oftentimes people can see you, get you started on an exercise program and give you some suggestions and maybe see you only a couple of times after that. Are contractures reversible? It kind of depends on how long they've been there and if there's been structural changes in the bones and shortening of the tendons with that. They probably are not reversible in that they won't go away completely, but hopefully they will. You can make them be a little bit less or prevent, because that's what some of the research studies have shown, that people actually did get more motion, but sometimes you don't get a ton of motion maybe in one joint, but you get more motion in a lot of joints, so you actually have more overall motion with that. And then also you really don't want to, you want to prevent any more loss of motion with that.
And I think we have one more question, and then I'll let you share about your study from Anna about the tips of fingers being sensitive.
Oh, that's a really good question too. You obviously can't wear gloves all the time, right? But have you seen that? There's some type of I don't know what it's called, but I'll try and find out. But you can kind of put it on the tips of your fingertips. It's like a little. Sometimes when people have burns, they put it on, like not severe burns, and it's like I can't think of the name of it. I'm so sorry. But it's like a desensitizer, can't even say it, that can protect your fingertips a little bit with that. With typing, though, what you could do, I can help with that. You can get like voice-activated typing, like the Dragon programs, and you could see it would slow you down, but you could use like a stylus, or pencils or something like that to type. So it's kind of like the old, fingertip, or what do you call it, index finger typing with that. But you could try and look into the voice-activated systems, because there are a lot of those out there for computers these days, and also for, on your phones with that.
Well, what we can do too, Janet, is if you remember the product that you were mentioning, we can circulate it back out to the group, and if there were any unanswered questions, we can try and address those in a post webinar email.
Okay.
But I'll let you go ahead and share about your study that you've got going on.
Okay, thank you so much, Amy.
You're welcome.
So I am doing a study with Dr. Kahn at the University of Michigan and Dr. Silver at the Medical University of South Carolina, and we have a grant to evaluate an internet self-management program for people with scleroderma, for the systemic scleroderma. And to be included in the study, you need to have the systemic sclerosis, be 18 years or older, read and understand English, have basic computer skills and access to a computer, and live in the U.S. And if you're interested in the study, what you do is you can either contact me or contact Jennifer there, or go into the website, but you will get hooked up to a website. You will fill out questionnaires, and then you'll be randomized to either the intervention, the self-management internet program, or the book condition. And randomization means like flipping a coin. It's like a 50-50 chance of being in either group. And then based on what group you're in, if you're in the book group, you will receive a book to read that will expect you to go through at your own pace and check in with you periodically. And if you have the internet program, then you will be given a password and go into the internet program and be part of an internet group. And then you'll fill out questions at the end of the study, and we'll follow you for 6 months. Even if you're in the control group, everyone will have access to the internet program at the end of the study. So even if you're in the book group, after you fill out the final 6-month questionnaires, then you will receive a password and a link to be able to look at the internet program too. And we do, because we realize this is a time commitment, we are able to be, and it's grant funded, we are able to reimburse people for their time at the beginning of the study, after they go through the book or the internet program, and we do check in with everybody, and then at the 6-month follow-up with that. We give people a gift card. So if you're interested, please let me know, or contact Jennifer, or email the Scleroderma Self-Management at umich.edu.
Okay, well, thank you, Janet. It looks like we're just about out of time. That's a really great session, and I hope that we've been able to provide some new information and tools for patients to better manage their scleroderma. As I mentioned earlier, this was our 20th webinar today, and I want to thank everyone who takes part in this program. For all of us at the SRF, it is an honor to bring this series to you and to be part of this community. So we are really grateful for your participation, and thank you so much. As always, we welcome your feedback. So when you close the webinar window, please help us by completing the short survey. You know, we're always interested in hearing what you want to hear about, so please be sure to include any future suggestions for future webinars. And then please remember that we depend on your support to continue our investment in the most promising research. So for more information, visit us online at sclerodermaresearch.org or call our offices at 1-800-441-CURE to support our program. Thanks again for sharing some time with us today. Thank you, Janet. Our next webinar featuring Dr. Elizabeth Volkman, a UCLA rheumatologist and scleroderma researcher, will be in July, so stay tuned for more detailed information. We look forward to having you join us. And remember, this and all of our other webinars are available for download on our website. And as well, we'll follow up this session with an email providing a link to the recorded session, as well as to all the slides that Janet provided today. So thank you, everyone. Have a great day.